Hello, health advocates. This is Dr. Lewis from the Health and Wellness Spot. Now, I received some tests and results from a client who thought it was wise that I actually share this video and educate you about blood in stool. So, of course, there are a lot of issues there that were supposed to be questioned, but I think it's very fair if you do a video in terms of bloody stool and if you should be concerned if at all you ever get blood in your stool, whether fresh blood or the dark blood in stool. So what is there a call for concern if you actually have this in stool? The answer will be at the end of this conversation. Now, realize this. Anytime you see blood in stool, fresh blood to be specific, in stool, bright red blood in stool, it's time for you to actually question, because we can be talking about hemorrhoids that have actually ruptured. We can be talking about rectal fissures or anal fissures. We can be talking about cancers. We can be talking about polyps or diverticular disease, okay? All these can actually present with fresh and bright red blood in your stool. Realize that when there is fresh blood in stool, this could be either a problem with the rectum, from the anus to the rectum to the ascending colon. So it's actually near the exit. That's why it's fresh blood in that stool. However, if the problem is a little bit high, let's say in the small intestines, in the stomach, and the esophagus, chances are high that your stool will be black because of the processes that this blood has actually gone through, and now it's coming out in stool as dark, all right? So that's the major difference. However, in some cases, you can actually get the upper GI presenting again with fresh blood in stool, but that is very rare cases, okay? Most times when you see fresh blood in stool, you have to question the rectum, you have to question the large intestines, and then of course the anal area. But the bright red blood in stool, it will warrant you to do further investigations. If you're a medic, you are supposed to do further investigations, and also the patient history, because you're supposed to understand a lot of things here. There's the family history of cancers. There's medication that this patient can be taking. There's other procedures that they're actually done that can actually be rupturing and causing more problems. So if you go shallow on it and simply give antibiotics and maybe a drug to stop the bleeding, you might be looking at it in a shallow way. So this will need further investigations and appropriate medical advice and care, because again, realize this person is actually bleeding. We don't know how much she or he has bled. We don't know the extent of the wound or something. We actually don't know what is actually causing this. Therefore, blood tests have to be done to ascertain if this person has lost a lot of blood, headed into anemia. Fluid administration has to be done to make sure that we actually balance the fluids before we even initiate more investigations and therapy. And then you can actually give temporary medication to actually protect them from infection and sepsis, as you just stabilize the patient and just continue with doing a lot of tests. But also check the kidneys, because kidney function tests, liver function tests, and heart function tests have to be done to actually ascertain these organs are properly functioning. There is no issues in terms of electrolytes that we've talked about before, specifically sodium, chloride, calcium, and potassium. And then medication, are they on any other medication? Like people who are using warfarin to thin their blood, or aspirin, these people have compromised blood clotting. Therefore, if a small crack in their rectum, they can actually bleed, because they don't have the ability to actually stabilize or form a clotting mesh that will stop the bleeding. So these things have to be checked all through. But I want you to see this, okay? You will get, if you get, again, the fresh blood in stool, I would like you to do this. Just run an entire gut profile. Start from the esophagus, go to the stomach, go to the small intestines, and then now come to the large intestines. So you can actually do multiple tests. An endoscopy can actually show you most of the upper GI. And then, of course, any gastroscopy examination can be effective. You can also do a colonoscopy to just show you how far this is, so that you can actually handle it with effective care that it deserves. Okay? But most times, if it's fresh blood in stool, you can simply start questioning either hemorrhoids or polyps, or a surgery that the polyps was actually removed, or you can question diverticular disease, or you can question an anal or rectal fissure, and this will start guiding your therapy so that you taper down that therapy. But of course, as you do the other examination techniques, you will know what is actually the problem. And of course, an abdominal pelvic, maybe ultrasound or that, according to the pain that they're actually feeling. Some of these people can actually be experiencing the inflammatory bowel syndrome or colitis, or there's a condition called intestinal ischemia, where there's limited blood flow towards the rectum that actually causes a lot of problems, or even the peptic ulcer disease, right? The one that is the duodenal one. So you can simply check out, once you do this investigation test, you do the physical examination, then you do the patient history, you will get your finger on the right. Even the physical examination can actually tell you if the problem is in the rectal area, the anal area, or above, so that you can actually recommend a colonoscopy. But above all, if you see just fresh blood in stool, you question the lower guts. If you see dark colored blood in stool, you simply question basically the dark stool. You question the upper GI. All right, don't be in a quick. You just give antibiotics without having to do the physical examinations and all that. And you easily see there are people who experience a lot of changes in bowel movement, and some of them will be lied to that, you know what, maybe it's because of the hormone changes, because of traveling, because of dehydration. Of course, they play a role in this. But now when there's stool in blood, you simply know there's a problem. In addition to this story, a lot of people are experiencing constipation because of a messed up gut and bad diets. This should actually be a very, very important thing in terms of the diagnostics. Question the diets. What is their cooking oil? Are they consuming wheat products? How frequent do they eat? How frequent do they get a bowel movement? All right. Is it trainable? Because the gut is actually trainable. So you can train the gut to be going for a bowel movement once in a day, and that is at 10 a.m. and the gut will oblige. So you check all these things. You check the bowel habits. You check the unexplained weight loss. What is happening? Are they experiencing any health? Is there any other condition that actually they are suffering from? Blood count. What does it show? Is their blood levels okay? And then the family history, specifically for people who are above 50 years, check for the family history for cancers and all these, the IBS, okay? So that you can actually see if there's a small link in terms of genetics and fix that. But for the constipation part, constipation and hemorrhoids, serious problem. When you have hemorrhoids, then you end up constipating. This hard stool can actually rupture these hemorrhoids, causing you a lot of bleeding. And what is actually causing this constipation? We all know is the diet and the messed up gut. If you have a weak acid in the stomach, you'll not be able to digest food optimally. If you have that weak acid, you'll now start accumulating a lot of issues. You'll have bacteria that is going into the gut, into the stomach, that are not supposed to be there. Therefore, problems start getting the bloating, now passing the gas, now then constipation. And then now you're experiencing constipation and somebody tells you, you know what, you should drink a lot of water. You know what, you should actually eat a lot of fiber. Now, you're getting constipated because you're consuming a lot of fiber that is not being digested. You're ending up overfeeding the gut microorganisms, and now they don't want to help you to digest the excess of the fiber. Now you end up getting constipated. And then somebody in their right mind tells you to add on more fiber. That will be a problem. So this is the time you should reduce the complex carbohydrates, reduce the vegetable intake to about 2 to 3 days in a week, and rehydrate with salt and water. The salt and water part is very important because salt will keep you hydrated, and salt will activate motility of the gut so that you can actually ease up on the bowel, and now you'll be safe. So this should be taken keenly, and this video is actually intended to open heads and eyes of our doctors when they're actually experiencing this. I thought you should know that.